Hello, all. In today's session, we are going to talk about cerebral dysfunction, a very broad but important topic in neurology and rehabilitation. Yeah, cerebral dysfunction is actually more common than most people realize. Globally, 1 in 6 people are affected each year. It impacts cognitive, motor, and sensory functions, which means it affects almost every aspect of daily life. Because of this complexity, managing cerebral dysfunction requires a multidisciplinary approach. So, coming to the definition, so what do we mean by cerebral dysfunction? So, it refers to impaired brain function that significantly interferes with daily activities. The impact can be localized or diffuse, or it may be temporary or permanent. The deficits can involve cognition like memory and concentration, motor control such as weakness and spasticity, or sensation including numbness or vision problems might also be happen. And coming to the etiology, cerebral dysfunction has many causes. Some of the main ones are traumatic brain injury. For example, over 2.8 million cases occur in US every year. Stroke, ischemic strokes make up to 87%, while 13% are hemorrhagic. So the neurodegenerative disease like multiple sclerosis and the other things are like infections like meningitis or encephalitis, brain tumors with more than 3 lakh people new cases annually, and the metabolic problems like hypoxia, hypoglycemia also leads to cause of it. And risk factors include age. Since the risk of stroke doubles every decade after 55, genetics also plays a role. For example, APOE4 gene in Alzheimer's. So lifestyle factors like smoking, poor diet, and inactivity contribute, as well as medical conditions such as hypertension, which increases the stroke by 4 times. Now coming to the pathophysiology and its types. So when the brain dysfunction occurs, several mechanisms are usually involved. So the neuronal damage due to ischemia or trauma leading to cell death, neurotransmitter imbalances such as dopamine deficiency or loss of acetylcholine, and inflammations from glial cell activation and cytokine release, and demyelination which slows down the nerve transmission. So together these changes leads to the typical cognitive, motor, and sensory and behavioral symptoms we see in patients. Yeah, coming to the clinical features, some of the common symptoms include, the first thing is cognitive. The patients will exhibit memory impairment, difficulty in concentrating, disorientation, or language problems like slurred speech will be exhibited by such patients. Whereas coming to the motor aspect, weakness, hemiparesis, spasticity, tremors, and balance issues might be happening. And coming to the sensation, numbness, tingling, visual disturbances, and impaired proprioception might also present. Other features may include headaches, dizziness, seizures, fatigue, and sleep problems might also be exhibited in such kind of patients. Now coming to the diagnostic interventions, diagnosis usually combines imaging, electrophysiology, and clinical tests. The first thing is nothing but neuroimaging, as we all know, MRI, CT, PET, and functional MRI to study the structure and functions is also being done. And the electrophysiology, EEG to assess the brain activity, EMG, and nerve conduction studies for nerve and muscle functions, and neuropsychological test tools like MOCA, where the scores below 26 indicate impairment is also being done. Lab test and physical examination are also important to rule out underlying causes. Yeah, what is the role of physiotherapy assessment and its goals? So, physiotherapy plays a major role in recovery. Assessments may include motor testings like MMT and Ashworth scale, whereas balance and gait using the big balance scale, whereas functional mobility is assessed with the timed up and go test, that is tuck test, or else film can also be used, where sensory and proprioception with touch and posture analysis is given. Yeah, coming to the goals include improving balance and reducing fall risk by about 50%, and increasing strength by at least 1 MMT grade, and enhancing gait by improving walking speed, reducing spasticity and pain, and ultimately restoring the functional independence must be the major goal in such patients. And coming to the physiotherapy interventions, therapeutic exercise like for strength, endurance, and ROM, and normal movement pattern must also be improved, and PNF for strength and flexibility, and balance training for both static and dynamic, gait training, and constraint induced movement therapy, technology assisted rehabilitation such as robotics, VR, functional electrical stimulations is also given to such patients. And what are the complications and patient education? Complications can include contractures, pressure ulcers, respiratory issues, depression, and that's why patients